money to the service sector. Instead, they should give it to the demand side, and that's what England call it. Money follows the patient. So if you don't look after my people, you don't get money from me. And so that's a big shift. And this is actually one of the beauty of having a social health insurance in the system. So here is some comparative comparative tables between South Korea and Taiwan. And so when we talk about social health insurance, you cannot leave Japan out. I mean, Japan is not in our analysis, but Japan is the first country to achieve universal health coverage way back in 1961. And the second one in line is actually South Korea in 1989, and Taiwan in 1995. And Japan started in 1907. They started with this program to cover government employee, and that took Japan 54 years to achieve universal health coverage in 1961. And it took Taiwan 45 years, and started from this labor insurance way back in 1950, and then the government employee insurance, and these are the two big ones. And then the farmer insurance, and the last is the low income, and then until 1995 when we cover the remaining 47% of uninsured into this one single pool, and that's our national health insurance. But if you look at South Korea, it only took them 12 years. I guess you just have better, they were ready. Their economy was ready, so they started from the very first insurance to cover employee in large corporations. So if you hire people 500 and more employee, and then by law you are mandatory to provide social insurance for the employee. And that's 1977, and took them only 12 years to extend the population coverage in 1989 to all the population. And Taiwan started in 1995. And but one thing to say about South Korea is when they started in 1989, the national health insurance. At that time, they have like more than 300 insured. So it's a multiple payer insurance system. But when Taiwan started off as a single payer system, and it has maintained that status until now. And so I guess seeing the successful experience of Taiwan or some other country, and that they through two phases, and by year 2000, all this 350 insurance society was merged into one single payer fund, and just like the system we have in Taiwan. So this is the transition from 1989 to year 2000. The South Korea actually went from multiple payer system to single payer system, just like the system for Taiwan. And U.S. has a debate about whether U.S. should have a single payer system. And Vermont, the governor of Vermont was so courageous. He made an announcement that Vermont will be the first state in the U.S. to have a single payer system. Well, unfortunately, that promise fell through in year 2014. Roughly 2 years ago, the governor of Vermont announced that the state of Vermont would not have a single payer system. And there were a few papers talk about this issue. Mainly it's political reason. It felt like this single payer concept is not favored by the voters and not favored by the majority of the U.S. and citizens, and so he decided to just let go, despite all these favorable policy sort of papers he has gathered. He actually set out to have a 3-team to evaluate the advantage of having a single payer system in the state of Vermont, and they all have very positive results. But at the end, by the end of the day, he decided not to push it forward with that. And the one similarity among the three countries, they all start with different sector of workers and gradually expand. So they cover all the people who are in the formal work sector, and then they expand the coverage to those who are not in the formal sector, and then make universal health coverage, achieve universal health coverage goal by covering who are uninsured, and those people many are unemployed into this risk pool. So here are some characteristics. South Korea has the system in place 1989, Taiwan 1995. Normally, they don't say 100% covered, but it is 100% covered. For the past few years, Taiwan, the Ministry of Health in Taiwan always say we are 99.9% covered. So what is this 0.1%? Well, those are the marginal pool, people who probably are not aware about the existence of national health insurance. Otherwise, by law, everybody even for people who are not citizens of Taiwan, as long as you have legal residency in Taiwan, you are covered. So all the foreign workers, imported workers, they are covered under our national health insurance, which makes Taiwan kind of attractive to a lot of overseas Chinese. These days, they will go to Taiwan, especially when they reach age 65. Taiwan will be the place to go because they can afford the health care there, and they are covered. And so some of the overseas Taiwanese and, of course, the fugitives, not even the policing system can track them down. So these are the sort of, people who are not covered. But the interesting thing about the South Korea system is that their national health insurance actually covers 97% of the population. The other 3 is the low-income population. This 3% of the population is actually covered by a separate scheme, which is called medical aid for the poor. And the provider who provides services to this group of people actually got paid differently. There's a different fee schedule. And so, of course, this is going to create inequity in terms of access to services. And I often ask them, why are they doing this? And they say, because this service for the low-income people actually comes in with sort of a whole package, which includes cash subsidy. So the government has not determined sort of to carve out the health part and make it merge into the national health insurance scheme, where Japan and Taiwan, all the low-income people are all covered under this national health insurance scheme. So they are treated just like anyone else. Actually, when you go to see a doctor, nobody will know you are actually low-income people. Only you will know because you don't need to pay copayment, and your premiums is 100% subsidized by the government, and that's the case of Taiwan. But in South Korea, this is actually carved out. And before they have national health insurance, most of the people who are covered are those people who have jobs, who are worker, employee in the formal work sector, and so these are all employment-based. In terms of administration, now South Korea, again, is a single-payer system. It's called NHI Corp. And this, ever since it is established, ever since it was able to merge in this 300-something insurance program in year 2000. And the institution that runs national health insurance in Taiwan is called National Health Insurance Administration, and that's for Taiwan.
Excuse me.
Yes.
In South Korea, those 3% low income.
Yeah.
Is it their insurance cover as the other people? Like if a poor person get cancer, get the same treatment as the other 97%?
Supposedly, but their providers actually are reimbursed by a different fee schedule, and this is what the inequity is likely to arise. But on the ballpark, pretty much the same. But the South Korea actually offer, in terms of benefit coverage, they are not as generous as the system in Taiwan, which is why we see the difference in terms of distribution of catastrophic payment when we get to that. So if you look at the benefit coverage, they are very much the same, but this is sort of by category, not by the scope. So a lot of services are not covered in South Korea. But I think it was starting year 2004, the government has made every single intention to expand the benefit package. So they actually had a few conferences. One of them I was invited to speak, and then they asked Taiwan, how you decide what's the sort of decision process in terms of coverage expansion, whether you should cover this, and do you use decision science such as cost effectiveness, benefit, or cost benefit analysis to decide which items should be covered first or not. And one of the campaign promised by the current president, President Park, is that she is going to expand benefit coverage because there's outcry from the public. People are not happy. They feel like they are covered, and yet they are not covered in terms of the scope of coverage. So you can see that by category, ambulatory services, inpatient services, they are all covered. And in terms of a choice of provider, they all have a freedom of choice in terms of provider they want to go. But in terms neither of the country actually has sort of a formal referral mechanism, meaning you don't need to see a primary care doctor before you can actually go to a medical center. What they do, just like Taiwan, is if you go to the medical center without seeing the primary care doctor, you need to pay a higher copayment. But it probably doesn't matter all that much because the copayment is really modest in Taiwan. It's probably just like additional 10, actually probably like $7 or $8 if you don't get referred by the primary care doctor. But in South Korea, their copay will be as high as 50% at the medical center, and that's kind of the big difference. But still, rich people can afford to go, so that doesn't stop them. In terms of government subsidy, essentially it depends on your occupation category in Taiwan. And pretty much, everyone will get some subsidy from the government. For example, I'm a faculty member of the private university. 35% of my premium is actually subsidized by the government. And the only category does not receive any subsidy from the government is those self-employed. On the contrary, the government in South Korea actually, partially subsidizes the self-employed group. And in Taiwan, that's the only group which does not get any subsidy whatsoever from the government. And all the other, will have different magnitude of subsidy, a different level of subsidy from the government. And currently, the premium rate is set at 5.89 of the payroll for South Korea. In Taiwan, it's 491. This is the year 2013, by the way, because now it's even lower. Now it's 4.69 on payroll and only 1.9 for this non-payroll income. And in 2013, it was 20. So Taiwan has this dual-track premium collecting system, which is very different from all the other social health insurance programs. When you look at the payment side, both countries, because it's a single payer, so there's a uniform fee schedule. So all the providers in the country will get paid, get reimbursed by uniform fee schedule. Everything's the same. In South Korea, the only exception are those covered by the medical aid group, which I mentioned. And again, despite the perversive economic incentive embedded in a fee-for-service system, both countries still largely reimbursed under fee-for-service. But they try to introduce DRG, but so there are some cases that so both South Korea and Taiwan, their National Health Insurance Corporation or administration is moving towards DRG, but not fully implemented yet. Taiwan is still at phase 2. Despite 4 years it has passed, still at phase 2. And now there's still a strong protest from the provider side. So I'm not sure whether the incoming government will have the nerve to really push it forward. But so now it's still partially implemented, but they see this as a policy goal. And the other difference is that Taiwan actually has a global budget, but South Korea doesn't. So the Taiwan's global budget is by services sector. So we have a global budget for Chinese medicine, global budget for dental services, global budget for primary care, global budget for hospital care, like any services provided by the hospital. And actually, outpatient services is a big chunk of it. So we have a global budget, so everything is capped. But South Korea does not have it. But I guess their economy has been doing much better than Taiwan, so they are not worried about that. So when they are running out of money, they just increase the premium rate, and doesn't cause any backfire like Taiwan. And if you look at the delivery system, this is the Western medicine practitioner per 1,000 population. You can see that South Korea actually has an ample supply, also more supply in terms of medical professionals than Taiwan, including beds. It's twice as much, almost twice as much as Taiwan. If you look at the provider ownership, both the countries are dominated by private sector. So if you look at a hospital, in South Korea, 94% of hospitals are in the private sector. In Taiwan, 84%. And in terms of hospital beds, 88 in South Korea and 67 in Taiwan. So I would say that South Korea is even more sort of predominantly, the service sector is actually predominantly by the private sector in South Korea. Okay, so I'll go very quickly about the data issue because I know this audience probably are not really into that. Anyway, the data we have is a household survey. So in every country, normally they will have their household survey. So in Taiwan, in the case of Taiwan, it's the survey of family income and expenditure. In South Korea, it's household income and expenditure. And so these are the sort of the total number, final analytical sample we have in our analysis. Both of the surveys are national representative, and these are the surveys that has been filled for more than 3 decades. So in Taiwan, I think the first one started in